Understanding Medicare Eligibility and Benefits. Medicare is a federal health insurance program primarily for people aged 65 and older. It also covers some younger individuals with disabilities and those with end-stage renal disease or ESRD. Medicare has different parts, each covering specific services. Part A covers hospital stays, skilled nursing facility care, and some home health care. Part B covers doctor's visits, outpatient care, preventive services, and some medical equipment. Part D helps cover the cost of prescription drugs. Understanding eligibility is key. You qualify for premium-free Part A if you or your spouse worked and paid Medicare taxes for at least 10 years. If you haven't paid enough taxes, you might be able to buy into Part A. Part B and Part D require monthly premiums, which vary based on your income. You can enroll in Medicare during specific enrollment periods, typically around your 65th birthday, or if you qualify due to disability. Navigating Medicaid, who qualifies and what's covered. Medicaid is a joint federal and state program that provides health coverage to low-income individuals and families. Eligibility and benefits vary from state to state. Generally, you must meet certain income, resource, and citizenship requirements. Medicaid covers a wide range of healthcare services, including doctor's visits, hospital stays, preventive care, and long-term care. It also covers prescription drugs, mental health services, and dental care for children. Pregnant women, children, seniors, and people with disabilities may qualify for Medicaid based on specific eligibility criteria. It's essential to check with your state's Medicaid agency for specific program details and enrollment information. Working with insurance. Filing claims effectively. Filing insurance claims can seem daunting, but it's manageable with a systematic approach. Start by gathering all necessary documentation, including your insurance card, medical bills, and any relevant medical records. Carefully review your insurance policy to understand your coverage and any specific claim filing procedures. When submitting a claim, ensure accuracy and completeness. Use the correct forms provided by your insurance company and double-check all information before submission. Keep copies of all submitted documents for your records. Follow up with your insurance company regularly to check the status of your claim. If your claim is denied, don't hesitate to appeal the decision. Understanding the appeals process is crucial for maximizing your insurance benefits. Deciphering your policy. Understanding your coverage. Understanding your insurance coverage is paramount to avoiding unexpected medical expenses. Begin by thoroughly reviewing your policy documents, paying attention to key terms like deductible, co-payment, co-insurance, and out-of-pocket maximum. Familiarize yourself with your plan's network of providers. In-network providers have negotiated rates with your insurance company, resulting in lower out-of-pocket costs for you. Using out-of-network providers might lead to higher expenses. If you have questions or need clarification on your coverage, don't hesitate to contact your insurance company directly. Their customer service representatives can provide guidance and address any concerns you may have. Fighting back. Appealing insurance denials. Receiving an insurance denial can be frustrating, but it's not the end of the road. You have the right to appeal the decision. Start by carefully reviewing the denial letter, paying close attention to the reason for denial and any deadlines for appeal. Gather supporting documentation to strengthen your case, such as medical records, test results, and letters of medical necessity from your healthcare provider. Submit your appeal in writing, clearly stating your reasons for disagreeing with the denial and providing all supporting evidence. If your initial appeal is unsuccessful, don't give up. You may have additional appeal levels available, such as requesting an external review by an independent third party. Persistence is key when fighting for your healthcare rights. Finding help locally. Community health resources. Navigating the healthcare system can feel overwhelming, but you don't have to do it alone. Numerous community health resources are available to provide support and guidance. Local health departments offer a wealth of information on various health topics, including access to care, preventive services, and disease management. Community health centers provide affordable health care services to underserved populations, regardless of their ability to pay. They offer comprehensive primary care, dental care, mental health services, and substance abuse treatment. Many community centers also have social workers who can connect you with other resources. Nonprofit organizations dedicated to specific health conditions or populations can provide valuable information, support groups, and advocacy services. These organizations can be invaluable resources for navigating complex healthcare challenges. Advocacy groups play a crucial role in shaping healthcare policy and protecting the rights of patients. These groups work tirelessly to raise awareness about critical health issues, lobby for legislative changes, and empower individuals to advocate for themselves. The American Cancer Society, the American Heart Association, and the National Alliance on Mental Illness are just a few examples of national advocacy organizations making a difference in the lives of millions. They provide resources, support, and a collective voice for those affected by specific health conditions. Local advocacy groups often focus on issues specific to their communities, such as improving access to care for underserved populations or advocating for better mental health services. Supporting and engaging with these groups can amplify your voice and drive positive change. Several government agencies provide health information, support, and resources. The Centers for Disease Control and Prevention, or CDC, is a trusted source for information on various health topics, including disease prevention, immunizations, and healthy living. The National Institutes of Health, or NIH, is the primary federal agency conducting and supporting medical research. Their website offers a wealth of information on various diseases and conditions, clinical trials, and the latest research findings. Medicare.gov and Medicaid.gov are comprehensive resources for understanding eligibility, benefits, and enrollment procedures for these respective programs. These websites also provide tools and resources to help beneficiaries manage their health care. Navigating the complexities of the healthcare system can be challenging, but Signal Health Group is here to help. With their expertise in healthcare advocacy, insurance navigation, and patient empowerment, Signal Health Group can guide you through the intricacies of medical billing, insurance claims, and access to quality care. Whether you need help understanding your insurance policy, appealing a denied claim, or finding affordable healthcare options, Signal Health Group's team of experienced professionals is dedicated to advocating for your needs and ensuring you receive the best possible healthcare experience. They understand the challenges individuals face when dealing with insurance companies, medical providers, and the healthcare system as a whole. Their mission is to empower patients with the knowledge and resources they need to make informed decisions about their health and well-being. Navigating the healthcare system can be daunting, but by understanding your rights, resources, and options, you can become an empowered healthcare consumer. Remember that you have the right to understand your medical condition, treatment options, and potential risks and benefits. Don't be afraid to ask questions, seek clarification, and advocate for your needs. Communication is key when interacting with healthcare providers, insurance companies, and government agencies. By being proactive and informed, you can navigate the healthcare system with confidence and ensure you receive the best possible care. Remember, your health is your most valuable asset. By taking charge of your healthcare journey, you can make informed decisions, access quality care, and live a healthier, happier life.